Good afternoon. My name is Tricia Sizer. The title of my presentation is an integrated review of school-based health services. The purpose of this presentation on an integrated review of school-based health services is to discuss a major healthcare problem that not only occurs here in the United States but worldwide. Today, a significant number of youth suffer from mental health disorders in the United States and worldwide. Those disorders include substance use, suicide-related behaviors, and depression. Wasserman et al. 2010 states that suicide is the third leading cause of death for ages under 25. For every suicide, there are 100 to 200 suicide attempts, and the greatest prevalence of substance use is among the age group 15 to 24. Out of all age groups, the greatest prevalence for substance use, including tobacco, alcohol, and illicit drug use. There are as many as 80% of youth who are in need of mental health services but are actually not receiving them. This is due to a lack of access to health care, which is contributed to by several factors such as inconvenient hours, long waiting lists, lack of providers, lack of transportation, and costs. Because the mental health care needs of adolescents have gained state and national attention, professional organizations are working diligently to develop strategies and goals to address this major health crisis. Mississippi is one of the states that has adopted several goals from the Substance Abuse Mental Health Services Administration. Mumberg et al. 2010 used a randomized controlled trial, and the findings of this study was pending the outcome of the follow-up measurements. However, it was hypothesized that school-based health services programs would lower the likelihood of unhealthy substance use. Tack et al. 2012 also used a randomized control study design, and the findings in that study also were pending the outcome of follow-up measurements. However, it was hypothesized that the depression prevention program that was used, known as OVK, would prevent an increase in depressive symptoms. Holder et al. 2012 used a randomized controlled trial study, and the studies were also pending the outcome of follow-up measurements, and it hypothesized that the resilience intervention would be effective in addressing adolescent drug use. Husky et al. 2011 used a randomized controlled trial, and the results of this particular study actually found that participants in the mental health screening programs were more likely to be referred to mental health services. It was also found that a significantly greater number of youth were in need of mental health services, thus providing a greater access to mental health care services. School-based health services is a promising improvement for nursing practice in the way nursing is delivered. This intervention is key to the promotion of mental health and well-being. A school-based setting is an excellent environment to institute a mental health care program. This will conclude my presentation on an integrated review of school-based services.